What is a doctor's weirdest case of a patient accurately self-diagnosing? When I was working the night shift at the ER, this 8-year-old girl walks in around 3 a.m. with her frantic parents. No visible injuries, no fever, not even crying. She marches straight up to the front desk and tells the nurse in the most matter-of-fact voice, "I need surgery tomorrow because my appendix is going to burst at exactly 2:47 p.m. The nurse looks at the parents like they're insane. The mom explains that their daughter Emma woke up from a nap and announced this, then refused to eat dinner because patients can't eat before surgery. The dad keeps apologizing, saying she's been obsessed with medical shows lately and they just want to rule out appendicitis to calm her down. Now I've seen kids fake illnesses to skip school, but this was different. Emma wasn't acting sick or seeking attention. She was sitting in the waiting room drawing pictures of what looked like surgical instruments, completely calm while her parents paced nervously. When I called her back, she walked into the exam room and immediately laid down on the table in the exact position we use for abdominal exams. I asked about pain and she shook her head. "It doesn't hurt yet, but it will start at 11:30 a.m. tomorrow, right here," pointing to McBurney's point with surgical precision. This kid knew anatomy better than some medical students. I pressed on her abdomen, checked her rebound tenderness, nothing, temperature normal, white blood cell count normal, every test came back perfect. But then she starts describing the surgery in detail. Not just they'll cut me open, but the specific type of incision, how they'll remove the appendix, what the recovery time will be. She's using medical terms I didn't learn until residency. I ask her where she learned all this, and she just shrugs. "The lady in the white coat told me in my dream. She said I needed to come here tonight so you'd be ready tomorrow." The parents look mortified, apologizing for wasting my time. But something about her certainty made me order an ultrasound and CT scan just to be thorough. Both scans come back completely normal. Perfect appendix, no inflammation, no signs of impending rupture. I'm about to discharge them when Emma looks at me and says, "You should write down the time I told you. You'll need it for your report tomorrow." Like she's giving me professional advice. I humor her and write 2:47 p.m. in her chart, figuring this will be a funny story to tell colleagues later. The family goes home around 6 a.m. I finish my shift thinking about this weird kid who diagnosed herself with a condition she didn't have. Then at 11:15 a.m. the next day, I get a call from day shift. Emma's back, this time screaming in agony, classic appendicitis symptoms. They rush her into surgery, and I check the time they wheeled her into the OR, 2:47 p.m. exactly. The surgeon later told me it was one of the most perfectly timed appendectomies he'd ever performed. The appendix was literally minutes away from rupturing, but they caught it at the exact moment for optimal surgical outcome. During recovery, I asked Emma about the lady in the white coat from her dream. She described her in perfect detail, down to the specific type of surgical mask and the way she wore her hair. Then she hands me a drawing she made during recovery. It's a portrait of a woman in surgical scrubs with a name tag that reads, "Dr. Sarah Chen." I nearly dropped the paper. Dr. Sarah Chen was our head of pediatric surgery who died in a car accident 2 years before Emma was born. The drawing looked exactly like her, including a small scar above her left eyebrow that wasn't in any hospital photos. Emma had never seen Dr. Chen's picture, never been to our hospital before that night. When I showed the drawing to other staff, they went pale. Dr. Chen was known for her uncanny ability to predict surgical complications and her obsession with precise timing. She used to say that surgery was about being in the right place at exactly the right moment. Emma made a full recovery, and the dreams stopped after her surgery. But before she left, she handed me another drawing. This one showed me in a white coat with a note, "Thank you for listening."